Hello, I am an MRI user. This time, we will look at female pelvis MRI. Gynecologic cancers include cervix cancer, endometrial cancer, and ovary cancer. Pelvis MRI is widely used as the best imaging test that provides important information in the evaluation of the size, extent, and presence of metastasis of a lesion. The female reproductive system is as shown in the picture, and all organs must be scanned during MRI examination. Compared to the epigastrium, the pelvis has fewer artifacts caused by movement, and relatively good images can be obtained. Fasting for 4 to 6 hours, and if available, intramuscular or intravenous injection of a bowel movement inhibitor, etc., and examination can reduce the movement of the internal organs of the pelvis. The first image is an image without the use of intestinal motility inhibitors, and the second image is an image using the motion correction technique to prevent image shaking caused by intestinal movement. The third video is a video using intestinal motility inhibitors. Among the image planes of pelvis MRI, there is a plane that acquires images using the double oblique technique, an image plane perpendicular to the long axis of the target organ corresponding to the indication for the examination should be obtained. For example, if an image is obtained perpendicular to the long axis of the uterus, as shown in the figure, the extent of myometrial invasion can be accurately assessed. There are things to consider here. That is, since the position of the uterus and cervix is three-dimensionally located differently for each person, it is necessary to change the angle twice to obtain images perpendicular to the long axis of the target organ. The double oblique technique is illustrated in this figure. In this picture, the image of the target organ we need to obtain is the uterus, which is located in the human body at a specific angle. What the user has to do first: adjust the position block at the angle of green color, vertically, with respect to the long axis, in the sagittal image. Second, in the coronal image, adjust the position block vertically to the blue color angle with respect to the long axis. In this case, there is a lesion in the uterus. An image is obtained by adjusting the angle of the position block, once sagittal, and once coronal, with respect to the long axis of the uterus. This patient has a lesion on the cervix. An image is obtained by adjusting the angle of the position block once sagittal, and once coronal with respect to the long axis of the cervix. In the case of this patient, there is a lesion in the ovary. Obtain an image by adjusting the angle of the position block once in the sagittal, and once in the axial with respect to the long axis of the uterus. If the lesion is larger than the specified FOV, the FOV should be increased to avoid clipping the lesion. Also, the slice thickness and gap should be increased so that the lesion is not cut. If you fix the slice thickness and increase the number of slices, the scan time increases. Gap should be used appropriately. So far, we have learned about the double oblique technique of female pelvis MRI. I hope this helps novice users to understand a little easier. Cheer up and be happy. Thank you.